Winter preparation, health effects of working in the cold. For acute effects of heat loss, within seconds, cold air cools the skin and upper airways, causing a gasping for breath, which may possibly cause hyperventilation, which can cause an increase in heart rate and blood pressure. There is also constriction of the blood vessels of the skin to preserve inner body core temperature. This decreases the amount of blood flowing to the skin, which decreases the amount of heat lost. Within minutes tissues are cooling, shivering begins. This is one method the body has to warm itself. There will be some neuromuscular deterioration which will cause a decrease in performance. Frostnip can occur. Within hours there will be a significant decline in the ability to perform physical work, which can be dangerous to the worker or others. Hypothermia will be apparent and cold injury will occur. A cold environment requires increased mental effort to handle new stress factors, which means taking protective measures to avoid further cooling. This can be distracting from the task. It also causes sympathetic nervous system to activate, which is the fight or flight protective mechanism that is an uncontrollable reaction to danger. This prepares the body for action if needed. Over days and months, acclimatization occurs, which is your body getting used to the cold, and your body learns to adapt. Once acclimatized, there is concern that with being exposed to the cold there is a higher risk for developing musculoskeletal disorders like carpal tunnel syndrome and hand-arm vibration syndrome. The table represents the stages associated with exposures to cold temperatures. Stage 1 is not a hypothermic state until you reach about 35 degrees. At this stage you will experience goosebumps. You will be unable to perform complex tasks since your dexterity is lowered. Shivering can be mild or severe, and your hands will start to become numb. Stage 2 is a mild hypothermic state, which is between 35 and 32 degrees Celsius. You will begin to experience violent shivering that persists, difficulty speaking, amnesia-like symptoms, reduced use of hands. You will experience stumbling, difficulty speaking, and signs of depression. Stage 3, or the moderate stage, is experienced when the core temperature reduces to 32 to 27 degrees Celsius. In the stage, body shivering stops, and your exposed skin turns blue. You will be unable to walk, get confused, and experience incoherent and irrational behaviors. Your muscles become rigid, will experience periods of being semi-conscious, a loss of awareness of others. Your pulse and respiration rate will decrease and possibly experience heart fibrillation. Stage 4, or the severe stage, occurs when your core temperature reaches a range of 27.8 to 23.9 degrees Celsius. You can become unconscious, your heartbeat and breathing becomes erratic, your pulse may not be palpable, as well as pulmonary edema, cardiac and respiratory failure, and death may occur before this temperature is reached. The lowest recorded core temperature for survivor of hypothermia is 14.4 degrees Celsius, which is extremely low and very surprising that someone survived that. Frostnip is the mildest type of cold injury. It is reversible and results in ice crystals forming on the skin surface. The exposed person is not usually aware that frostnip is occurring because it is usually painless and develops slowly. It typically occurs on the earlobes, fingers, toes, cheeks, and nose. Frostbite is caused by the actual freezing of soft tissue. It is often seen with extremely cold temperatures and wind. The bare skin will begin to freeze at -2 degrees Celsius, 28 Fahrenheit. The exposed areas are most often affected are the cheeks and ears. There is no classification of degree of freezing as we have with burns. It begins with local swelling and redness, paresthesia or anesthesia. The skin whitens with a waxy appearance, and if it is deep, the skin will feel hard. Treatment is to block cellular injury and prevent tissue loss. Except for the most minor frostbite, all should be hospitalized for treatment. Hypothermia is a systemic cold injury, which means it involves the whole body, and is diagnosed when the core body temperature drops below 35 degrees Celsius or 95 degrees Fahrenheit. Signs and symptoms of hypothermia are nonspecific and gradual, including drowsiness, slurred speech, irritability, impaired coordination, general weakness, combativeness, and cool skin and face. This condition requires immediate medical attention. Hypothermia summary. 35 degrees Celsius is the threshold of hypothermia. At 33 degrees Celsius there is impaired muscle function, introversion, loss of mental alertness. At 30 degrees Celsius there is cessation of shivering and then unconsciousness. At 28 degrees Celsius ventricular fibrillation is possible. At 26 degrees Celsius will experience bradycardia, slow heart rate, and bradypnea, slow breathing rate. At 24 degrees Celsius death is possible. Chilblains results from repeated exposure to water with bare skin or the cooling of an extremity over hours or days at temps just above freezing. Trench foot is a severe form of disability. The skin reddens, then pales. Paresthesia and anesthesia occur. 2 to 3 days following rewarming, plus pain, swelling, redness, heat, blistering, possible gangrene. Chronic cold sensitivity, excessive perspiration and excess pigmentation may occur. Frequency of injuries. It is estimated that 64% of cold injuries involve the hands or feet and then followed by nose and ears. According to Workplace Safety and Insurance Board of Ontario, there are about 60 cases of cold injuries that are reported each year. Risk factors. Age. Older adults are at risk due to the fact that our circulation decreases as we age. With poor nutrition and fatigue, the body can be run down and less able to protect itself from hazards. Of equal importance is that you maintain proper fluid hydration. Alcohol and smoking, both affects the blood vessels and body's ability to control temperature. Alcohol is a vasodilator, while smoking is a vasoconstrictor, which contradict each other. Medications such as narcotics, tranquilizers, antidepressants, and blood pressure medication all decrease circulation to the skin. Underlying medical conditions such as diabetes and heart disease also affect blood circulation. Inadequate, tight, wet clothing, previous cold injuries makes you prone to recurring injuries, and Raynaud's phenomenon, which is spasms of the blood vessels that result in reduced blood flow and discoloration of the affected areas. Factors affecting cold perception. Acclimation. If you are not acclimatized, you are going to feel colder than someone who is used to the cold. Wind chill, which is a combination of temperature and wind speed. Physical fitness. If you are physically fit, you will usually feel warmer. Moisture in the air. Activity. Equipment design. Time of the day: it is warmer during the day compared to the evening. And duration of exposure. Wind chill effect. This table is adapted from the American Conference of Governmental Industrial Hygienists, ACGIH, and demonstrates what happens when the external temperature and wind speed are combined. For example, if it is -7 outside and there is no wind, the experienced temperature does not change. However, if the wind speed was 24 km per hour, the experienced temperature reduces to -21 degrees Celsius. For additional information, visit www.ocow.on.ca.